All members of the Medical College of Wisconsin community come to work and learn in an environment where individuals are treated with dignity and respect. Welcome to Respect Training, Anti-Harassment, Non-Discrimination, and Employee Responsibilities. The purpose of this training is to communicate our culture of professionalism, awareness of our reporting process, encouragement of early intervention, and responsive action. MCW is committed to you by creating and sustaining a safe learning and working environment that recognizes and values the dignity of all members of the MCW community. We are collectively responsible for providing a respectful environment for all employees and students. MCW will report findings of prohibited offenses such as sexual harassment violations as required to external agencies such as the National Institutes of Health and the National Science Foundation for researchers, as well as through the credentialing process for clinical providers. By accepting employment with MCW, employees agree to be part of a culture of professionalism and acknowledge that findings may be reported. MCW recognizes that professional conduct among all members of this community is essential to advancing this institution's critical missions of patient care, education, community engagement, and research. We are committed to creating and fostering an environment of respect, excellence, and magnanimity. These values embody the foundation that supports all that we do at MCW. Take a moment to learn more about the MCW Professionalism Code. As a basis to understanding respect, it is helpful to think through the following tips for respectful behavior. We encourage you to treat others not how you want to be treated, but how they want to be treated. Please take a moment to read the following tips. There are various types of harassment. Take a moment to learn more. Quid pro quo refers to any employment decision or action based on an employee's willingness or unwillingness to grant or deny sexual favors. Examples include, but are not limited to, demanding sexual favors in exchange for a promotion or raise, or changing performance expectations after a subordinate refuses a request for a date with a supervisor. A hostile work environment occurs when the unwelcome conduct of anyone, including vendors and patients and others we may come in contact with in our environment, based solely on the protected class of an employee. For example, verbal or nonverbal behavior that focuses on the sexuality of another person or occurs because of a person's gender. Verbal or nonverbal behavior that is unwanted, unwelcome, or offensive to someone based upon their race, or behavior that is severe or pervasive enough to affect the person's work environment and is based upon their religion. The hostile work environment must be determined to be severe or pervasive, in that it alters an employee's conditions of employment and work environment. Harassment comes in various forms, but the most common are physical harassment, verbal harassment, and visual harassment. Take a moment to view the different forms of harassment. As an education institution that receives federal funding, we must follow Title IX of the Education Amendments Act. Title IX is a federal civil rights law that was signed in 1972 that prohibits harassment and discrimination on the basis of sex. MCW and other educational institutions like us must take action when we become aware of prohibited conduct under Title IX. Examples of prohibited conduct include pressuring colleagues or students for sexual favors, spreading rumors about sexual activity or making false accusations, telling sexually explicit jokes, making suggestive, insulting, or obscene comments, or pressuring alcohol or drug use in order to take advantage of someone. As a member of the MCW community, you are considered to be a mandatory reporter and have the duty to report information received regarding incidents of all forms of harassment and discrimination. This can include sexual assault or sexual violence, domestic violence, dating violence, stalking, and sex discrimination. Any suspicion of abuse to a minor must also be reported to law enforcement. Use Your Voice is MCW's Title IX brand focused on prevention and awareness. We encourage you to use your voice to address issues of discrimination and violence. There is an exception of the requirement to report sex discrimination and harassment. Providers who are clinically treating an employee as a patient are not responsible for reporting information learned about sex discrimination or harassment in order to preserve patient confidentiality. Many situations of unprofessionalism and harassing behavior occur in the presence of bystanders, people who witness an incident but are not directly involved. Bystander intervention is the interruption of potential harm by someone who witnesses an incident. Bystander intervention can be a safe and effective way to prevent sexual harassment and violence. If you are directly observing a situation and when deciding to intervene, take these steps. Notice the event and evaluate the risk. Determine whether the situation demands your action. Assume personal responsibility by making the situation your problem. Choose what form of assistance to use, and understand how to implement the choice safely. When possible, we want you to safely intervene in a situation that you witness to assist a colleague that may be in need of help. Learn more about some strategies you can use to be an active bystander. The CARE model is an easy-to-remember acronym that lists some of the ways you can respond and take action when you witness an incident of unprofessionalism or harassing behavior. You can use one or more of these strategies for a given situation depending on your comfort level and personal style. It is important to keep your own safety in mind at all times. Be an active bystander by showing you care. Create a distraction by starting a conversation or asking a question to the parties involved, such as directions to a nearby room or department. Ask the person directly if they need assistance by asking if they are okay or if they would like to talk. Refer to an authority, such as your Title IX coordinator, MCW Public Safety, or local law enforcement. Sometimes the safest way to intervene is to call for help. Enlisting the help of others. Phone a friend or have them come assist you. Some situations are too intimidating to approach alone. And remember, your actions matter. Scripting is a method to prepare and practice dialogue you would be comfortable using when you encounter an incident. Scripting allows you to decide how you will respond as an active bystander and help you prepare and practice saying the script out loud. This will ensure you are comfortable and confident when you intervene to provide support to a colleague. Practice using a script can reduce fear of being an active bystander and assist you in being comfortable in speaking up. Take a moment to read a few suggested options to say or do when developing a script. Feel free to make note of the suggested options to say or do as an active bystander. We recognize from time to time faculty, staff, trainees, and students may have questions or concerns that must be addressed to optimize their work and learning and ensure their safety. To provide a roadmap for how to navigate these concerns, MCW's Compliance Reporting Hotline, hosted by a third-party hotline provider, Ethics Point, for situations where someone would prefer to place a report in confidence with the option to remain anonymous. Take a moment to review the hotline information and make note of it. Please make note of the additional resources available to you at MCW Milwaukee campus and the Milwaukee community. Please make note of the additional resources available to you at the Green Bay Regional Campus. Please make note of the additional resources available to you at the Central Wisconsin Regional Campus. To learn more, visit www.mcw.edu. Search Sexual Misconduct. Here you will find important information and resources, including policies and links to Title IX information. Thank you for completing RESPECT training.